Hi there. Thank you for your question. It's an excellent question. And let's talk about this. So, what can you do when you're trying to conceive, trying to get pregnant, and you have ovarian cysts? First of all, I'm very sorry that you're going through this. And I do have a number of patients and clients that I work with that are in a similar situation. I don't know your whole story. So, what I can tell you is that traditionally, with allopathic or Western medicine approaches, usually what they'll do is use laparoscopy or hysteroscopy to do exploratory and then find and locate the cyst and see if there's any other issues, because sometimes they'll also find endometrial tissue like endometriosis that's in there. I'm looking at a study right now. Okay, so a lot of times there's like adhesions that are showing, so they'll excise them or they'll remove them from the area. Now, this is the Western approach. It's more like exploratory and then remove everything that could be blocking and causing a woman to have infertility. Now, when they do this after that's completed, usually what they'll do with ovarian cyst or polycystic ovarian syndrome is put a woman on letrozole. But the challenge with this is I'm looking at this study. It was actually a little bit older. And looking through a few of them, but the one that I'm looking at right now is close to about 10 years older. And it's saying that once they go on letrozole, unfortunately, then a cyst that wasn't removed, maybe it's just too small to get removed, burst. Which maybe, hopefully you haven't experienced that, but I hear from patients and clients that it's horribly painful, and also it sets back the clock on being able to conceive and get pregnant. So what I do with my patients is, aside from going, okay, how can I treat the ovarian cyst, I want to back it up and look at the root cause and look at the foundation of either what's causing the cyst, but really what's flaring it up. Like, what is triggering it for the cyst to keep producing and keep creating and then preventing pregnancy from happening. So how do you do that? Basically, I have people track with a journal, and they can go through different symptoms that they have in their entire body, not just pain and or irregular menstrual cycles, that kind of thing. All that is helpful. Like, everything has to be factored in. And then we look at some things that we can add in to ease comfort, improve circulation, decrease inflammation, especially in the womb area, but really in the entire body. And how do you do that is going into the gut. So you got to heal the gut and the gut biome, essentially, to address this kind of issue. And it has to be on a daily basis. It's not a one and done treatment. It's an ongoing, really a lifestyle care plan to prevent that, and then to open up the possibilities of conceiving. And it is possible, and it does happen. So that's where I would start. I would start with looking at the gut health, gut inflammation, and work on that. Now, other things that can get added in, like there's different supplements, there's definitely herbal medicine that can help to shrink cysts, dissolve them, less pain, increase circulation, all these things decrease inflammation. And that's from Chinese Western medicine, does really well with removing excess fluid or excess dampness that gets stuck, and it can cause these ovarian cysts. But one that's actually mentioned in this research is Vitex. Now, Vitex has a good amount of research behind it for being helpful with ovarian cysts or polycystic ovarian syndrome, hormone imbalances in general for women, menstrual irregularities, menstrual pain, that kind of thing. So that is an herbal supplement that's worth looking into. But again, like, you've got to work with somebody so they can see, oh, is that an appropriate fit? So after saying that, I would definitely say go back to the diet, look at that, see what some causes could be. And it's helpful no matter who you decide to go with or work with or have on your fertility journey. that they will have a journal to look at and say, oh, okay, this food's helpful, this is good, how about let's add in more of this, or I don't see this in your diet, let's look at low glycemic, low, like anti-inflammatory foods, that kind of thing. Omega-3s, add those in for anti-inflammation. There's a number of ways to address ovarian cysts with diet. And then also looking at things to remove from the diet, which stands out the most is going to be more like processed foods, things that congest things in the body where all the systems aren't speaking nicely to each other. So that's creating more like a stagnation and fluids, and that can bottle up the cyst and create more. So processed foods, fast foods, damp creating foods, there's a whole list. In fact, if anybody is watching this and if you're getting this reply, let me know, because I do have a PCOS diet, just a little bit of a guide that gets like starter foods, that kind of thing, that can be helpful. So just like drop a comment and I'm happy to send that over. And I hope that I gave you some clarity to your question about ovarian cyst and trying to get pregnant, trying to conceive, and I wish you well. Thank you for asking.